Constipation can be an uncomfortable condition for many people, especially when traveling. Long-term constipation brings with it numerous complications, including hemorrhoids. Especially in older people, constipation can lead to increased ammonia levels in the blood and impaired consciousness. Be careful. Pushing too hard during bathroom time can be dangerous, especially for those with brain aneurysms. With blood vessels bursting, it could even lead to a stroke or worse. Most of us think that constipation means not having a bowel movement, but its definition according to gastroenterology specialists is different. Constipation means having very difficult or painful bowel movements, or having very small amounts of stool, especially in this way. Remember, the frequency per week varies for each person, but having bowel movements from 3 times a day to 3 times a week is considered normal. Our food is first absorbed by the small intestine. The mucous membrane of the small intestine has circular folds. On these folds are the so-called intestinal villi, on which cells are located. These cells are shed every 2 to 5 days and end up in the intestine to make room for new cells. The remains of the dead intestinal cells, unabsorbed food, water, and minerals accumulate in the large intestine. On their way through it, they lose water and become harder. When they reach the rectum, they trigger the urge to defecate. The pelvic floor muscles keep the pathway to the rectum closed. Relaxation of these muscles makes defecation possible. If someone has an issue with their pelvic floor muscles due to a stroke, childbirth, or old age, they may have problems passing stools. In addition, some medications, too little fiber, and dehydration can slow down bowel movements, resulting in dry stools that are difficult or impossible to excrete. If the constipation is accompanied by fever, bleeding, weight loss, or severe pain, it is important to consult a doctor. Otherwise, observing the following principles can help to alleviate the symptoms. The first step is to improve your diet by eating fiber-rich foods such as figs, dried plums, and whole grains. It is important to drink at least 5 to 8 glasses of water every day. Suppressing the urge to defecate can also make constipation worse. When defecating, it helps to bend forward at a 35-degree angle on the toilet so that the rectum is positioned correctly. Using a stool to elevate the feet can also be helpful. Daily 45-minute walks can also contribute to regular bowel movements. If the above methods do not provide relief, laxatives can be used. However, it should be noted that some laxatives have a very strong effect and can lead to complications such as stomach bloating, flatulence, and tummy cramps. Long-term use of laxatives can lead to intestinal sluggishness and disrupt the water and electrolyte balance. This can be accompanied by symptoms like headache and lightheadedness. It is therefore not advisable to take laxatives for long periods unless they are prescribed by a doctor. But the most important thing is to be happy and relaxed.